one of the things I believe about burnout is it's not so much the severity or the acuity of the work you're doing, but it's the lack of support. It's when you don't feel that you have support to do the work you're doing that these symptoms start to really show up. Does that fit with what you know about burnout? Good morning. Glad you're here. I'm here today with Wesley Curton. He is a student intern in our agency, A Better Way Counseling Service. And if you haven't done so already, please hit the subscribe button and the like button down below. Wesley is here to talk about a group that he is about to start. For lack of a better term, it's a group on burnout, and some people call it compassion fatigue, and I think there are other terms, but it's basically a group for people who, are having signs or symptoms or experiencing burnout in their profession. And we're going to talk more about who that would apply to. But let me start, Wesley. Tell me the general premise of this group and what is burnout to you? What does it mean to you?
Yeah, so the general, well, first of all, thank you for having me and hosting this conversation. So the premise of burnout and what this group is going to be about is basically burnout presents in three different ways: kind of emotional exhaustion, depersonalization, and then a decreased sense of satisfaction with whatever you're doing. So the interpersonal, the intrapersonal, and then how that impacts what you're doing. And so this group is kind of geared to address that through self-care, self-compassion, and a couple different strategies.
So you said, let's list those three things again, real briefly. What were they again?
Yeah, so the research kind of points to three areas. So emotional exhaustion, which would deal with the interpersonal factors in whatever your work is. Depersonal.
Let's take them one at a time. Let's start with emotional exhaustion. Tell me what that is and what it looks like.
Yeah, so emotional exhaustion could be the feelings of burnout could present as just being frustrated, being tired, just lack of motivation. It could even present as depression or anxiety. It could come out in different ways. But emotional exhaustion, the kind of the physical responses, physiological responses to what's going on, right?
Okay, and what was the second one?
Yeah, so the second area of burnout would be depersonalization. So that what's happening internally, right? The decreased sense of maybe competency or self-worth activation, or maybe shame, or maybe just negative self-talk, accompanied by those feelings of exhaustion and frustration.
Does depersonalization also include like having a lack of interest or compassion for others?
Yeah, it could really lead to not only dissatisfaction, but maybe some resentment, right? Or the inability to connect or have empathy for others. Right.
That's where that term compassion fatigue comes from for helping professionals. Now, what was the third one that you said?
Yeah, so the third area is kind of decreased sense of like satisfaction in your work. So what's happening interpersonally, intrapersonally, and then how that plays out in not really wanting to do what you're doing, whether that's helping or coming alongside others in their journey, but just that decreased sense of wanting to do it or even being able to do it well.
And so, yeah, one of the things that I've talked about burnout a few times in our agency, and one of the things I want to see what you think of this premise, that one of the things I believe about burnout is it's not so much the severity or the acuity of the work you're doing, but it's the lack of support. It's when you don't feel that you have support to do the work you're doing that these symptoms start to really show up. Does that fit with what you know about burnout?
Yeah, I think that definitely fits within the research, right? So the research points to kind of what does social support look like, and then the support you provide yourself through like positive self-talk, self-compassion. So I think that definitely tracks. That support is a huge protective factor against burnout.
So one of the things I noticed when you were talking about the three areas is that they kind of overlap each other and interconnect with each other. And the last one I want to touch on, this dissatisfaction with your work. I've seen that throughout the years of people who I think are experiencing burnout in the mental health field. particularly, but in other fields also. And what I see happen for folks, and you can chime in on this, is they come to a point where they either decide to figure out how to deal with their burnout, how to find a part of their work that they're excited about, how to maybe change the way they're going about their work so that they are more enthused about it, or they change direction and do something else in life. And what do you think about those ideas?
Right. So I'm pretty new to the field, so I can't speak from personal experience of, seeing a ton of attrition.
Right.
But ultimately, that is what the research points to, is this sense of attrition within the field, either leaving the field altogether or like this calloused, kind of like shut down emotional, where you'll still do the work, the person might still do the work, but their just heart's not in it, right? So the goal of burnout is to think about how can we holistically, change that and help the attrition and actually retain in our fields as helpers.
Right. Okay. And so what are the signs of burnout?
Yeah, so I think some good signs would be in that emotional exhaustion and depersonalization categories, those two. So noticing a lot of frustration or anger or resentment in your work, or just feeling like, gosh, I'm always tired, right? When I come home, right, if I have a cup, it's never getting filled. I'm just always giving and giving. And that can lead to the negative self-talk too. So feeling like just what I'm doing, it's just not worth it, or I'm just always getting drained. So those could be some of the warning signs.
Would a sense of hopelessness be part of that?
Totally. If you're feeling hopeless in your work or just as a person in your work, that can definitely impact burnout, because it's those three categories together, right? So an impact in one is going to impact the other two.
Yeah, the idea that I'm working really hard, I'm going after this, I'm working with challenging populations, and I'm starting to believe or feel that I'm not making a difference. And maybe the structure that I'm in or the organization I work for isn't changing to, or isn't willing to address problems that need to be addressed, or isn't willing to create support for how hard we're working. To me, I would imagine those conditions really exaggerate burnout.
Yeah, I think I would agree with that. That if you're not supported, if one is not supporting their work and they're working really hard and they want to see change, and it's just, they're hitting a wall, that compounded impact over time is going to lead to kind of that, like, okay, well, I'm not getting anywhere, but I'm still doing this thing and it's just not going anywhere. And so that sense of there's no accomplishment, right? And that would be that third area where I lose interest,
Right.
Lose interest.
So this group is geared towards helping professionals. Let's go through a list of who helping professionals are, and I'm sure we won't cover every one, but what comes to my mind, obviously, you started this group originally thinking about clergy, but we're expanding it to the idea of helping professionals. But obviously, people that work in the spiritual arena, clergy, pastors, ministers, but also psychotherapists, counselors, nurses, teachers, law enforcement, and that list goes on and on. Anybody in the quote helping professions and medical professionals, and I imagine right now some of the folks we just listed, the opportunity for burnout has gone up dramatically given the current situation. Is that how you see this? Is that the group that you're hoping to work with, and do you see it as being very germane right now?
Absolutely. So I originally created this group around spiritual leaders. And what was interesting is, as I got into the research, a lot of the research pointed to spiritual leaders are often kind of that like first line of defense for some people if spirituality is a part of their life. But what the research really pointed out is that across the board, helping professionals see similar levels of burnout, and that includes many of the people you mentioned, medical professionals. I'm thinking right now, especially as we're still in the middle of a pandemic, how exacerbated burnout and the need for services is, and also what does the support look like. So that when you speak to it being germane, absolutely, I think this is a timely group. So medical professionals, nurses, primary care physicians, mental health clinicians, social workers, and spiritual leaders. I think police officers, firefighters, EMTs, kind of like those people who have been on the front lines of the pandemic over the last 2 years, have seen an uptake, excuse me, I would think, of people needing services and wanting assistance. And the goal of this group is to come alongside those helpers and say, what does it look like to support the helpers who have been demanded so much of over the last couple of years, to hopefully avoid some of that attrition, right?
Right. So I'm going to imagine, you can tell me if I'm wrong, that, you know, somebody who's, say, a medical professional who's working really hard and dealing with really challenging issues right now, you know, they're not, the goal isn't going to be to change the system they're in, but to figure out how to work within it and still take care of yourself. Is that an accurate assessment of what you might talk about in group?
Absolutely, absolutely. So we are parts of a system, and the whole system's not going to be in the room, right? But how can we look at my role in the system? So how can I increase my self-compassion? How can I increase my self-care strategies, whether that's the micro, you know, hour to hours, or the weekly, you know, self-care practices? How can I increase better boundaries? You know, so, and that's going to impact the system, but ultimately it's a look at the individual, right? So I can't change, you know, the mental health system or the hospital system, but what does it look like to take care of the person, right, themselves?
One of the things I see in helping professionals throughout the years as being a therapist is a common theme of feeling responsible for others and feeling you have to take care of others, and often at a detriment to taking care of yourself. And so I'm assuming in your group there is going to be focus on how to take care of yourself, and that is, if you call it selfishness or not call it selfishness, it's important. It's necessary to, you know, I know from the mental health field that if you don't take care of yourself, you can't do this work for long.
Right.
Is that part of what you might cover, this idea of, you know, feeling responsible for others, you know, what I call the difference between caretaking and caring?
Yeah, and I think that's a helpful distinction, right? So we want to be caring, and also if I'm not taking care of myself, if I'm not aware of my, you know, things that activate me, or if I'm not filling my cup, I'm actually not able to care for others, right? Because I'm trying to give them a cup that's empty, and that actually creates more harm to the people I'm trying to serve and help, and it also is going to lead to more burnout for me as a clinician, right? So the idea of looking at self-care as not selfish, but actually fundamental. I mean, it is selfish in some degree, but it's fundamental to providing ethical and like sustainable helping, right?
That metaphor of the cup, you know,
Yep.
I have to pour into it to be able to pour out of it, I think is a really good metaphor. It's a real easy one to understand. And the idea of pouring into it, you know, hopefully if you're in an organization that is helping you pour into that cup, that's fantastic. And it may not be fast enough or enough, but even if you're not, our need to figure out how in the world to get support for what we do, whether that's through our family or our friends or our coworkers or our own support groups or whatever that might be. I'm assuming you're touching on that in this group, is how to fill that cup if you're not getting it from the organization you're working for.
Right. Yeah, and that's part of the design of this group. So kind of a built-in buffer, if you will, is that the people in the group itself provides a meta support system, right? And like we mentioned earlier, social support is crucial to avoiding burnout and helping persist in the field. And so whether that's looking at, you know, 1 week might look at boundaries and what it looks like to have boundaries. Work-life balance is something that helpers talk about all the time. But what does it actually look like, right? What does it actually look like? So 1 week might be on boundaries. 1 week might be on looking at self-compassion. 1 week might be looking at, what does social support look like for you outside of work? Who are your friends that aren't coworkers, right? Right. We can have relationships with coworkers. We need that. And what is your world outside of just work? And so that might be some of the process to holistically, yeah.
Can you go over, I mean, you're starting to wander into my next question with what are the goals and topics that are covered. Can you go over some of the goals and topics?
Yeah. So, boundaries for sure. The research really points to self-compassion as being one of the key protective factors. So we're definitely going to spend a week or two on self-compassion, self-care strategies, right? So the nuts and bolts of it, social support, have a couple weeks built in to kind of just understand the context of what this group is happening in, right? In a time when there's a global pandemic and increased social isolation, which I would imagine has kind of exacerbated some of these burnout. So creating space for some of those larger topics, and also what's happening in the space, what's happening in culture, and how is that impacting our emotional exhaustion, right? It's kind of like this new normal where we're all so strung out, but truly, how do we acknowledge that and have compassion for yeah, there is a lot going on, right? And I'm also helping.
Well, I think this is an extremely important group, pandemic or not. I mean, it's an important topic for all helping professionals to really be paying attention to be thinking about, to be trying to become aware of the signs that they're entering into burnout, because burnout can be very serious. It can be really toxic to your well-being and to your health, and not only your mental health, but it can affect your physical health, and certainly affects your career. So what makes you passionate about this group?
Yeah, so for me personally, I grew up in a family with a helper, and so just trying to see, gosh, what does it look like to have a front row seat to a helper outside of their space, right? And then as I kind of grew up and developed and kind of stepped into this field, having really good mentors along the way, supporting me and challenging me on my own self-care, and then really becoming passionate, kind of going back to that cup, that I think having conversations around burnout, having conversations around self-care creates a healthier field, right? And the healthier we can be as helpers, whether that's us as mental health clinicians, medical providers, police officers, first responders, spiritual leaders, the healthier we are, I think that creates a healthier system, right? So that could lead to more ethical practice, maybe less abuse. I mean, I don't know. I'm not saying this is true. And also, I wonder what would happen if we truly all took our own self-care as serious as we do helping others, right?
Absolutely.
So I think it makes a healthier system.
So you're a student intern who hasn't had time to experience burnout yet. Can you tell me, if I'm a professional who's been in the field for a while, why would I come to a student who's leading a group on burnout?
Yeah. So like I said earlier, I don't have a ton of years of experience to say, yeah, these are all my stories of burnout and how I conquered it. And I don't think that's realistic, right? And that's not what this group is for. It's not to say I've conquered and I have the right recipe, but I am someone that's willing to say, hey, I think this is important. And I want to create a space where we can have honest and candid conversations that, yeah, burnout's real. And we want to work to build that self-compassion. And so while I don't have 30 years in the field, this group I've based on the research that says self-compassion, boundaries, social support, these are the protective factors against burnout. And so wanting to create a space, right? And if I can lean on my inexperience, right, I can say, you're right, I am inexperienced and I'm coming in wanting to come alongside you and others. So I think that's important.
You're coming in with fresh motivation, which I think is really probably an important thing for a group like this.
Yeah, it's important to note that, it's hard to lead a group on burnout if I'm burnout, right?
Exactly.
Yeah.
Exactly.
Yeah.
Okay, is there anything else you want to say about this group or this topic?
Yeah, I would just say if you think you're a helper in the smallest sense, consider this group, right? So we all are in systems. We all are impacting others in relationship, at work, in our careers, in our social circles. And if you consider yourself a helping professional, I would encourage you to consider this group, especially given our climate, right, of all the change that's happened over the last couple of years, and how exacerbated all of our just day-to-day lives are, let alone our work. And so, yeah, I think this group could be for you if you consider yourself a helping professional.
So one of the things that we talked about, I want to circle back to, when you're talking about boundaries, I wanted to mention that I think there's two things that are really, really important when we talk about boundaries for helping professionals. And one is learning how to say no when you need to say no. And the other is learning how to say yes when you need to say yes. And I think this is a group people need to really consider saying yes to if they're a helping professional, to particularly if they're feeling some toxicity in their work. And I really appreciate you sharing that. There will be information in the description down below, as well as a link to a flyer that will have more information on how to sign up for a group like this, or this group. And boy, thank you so much, Wesley. Really appreciate you talking about this.
Yeah, thanks for having me.